Hi, this is Dr. Radialis, and today's subject is all about menstrual. For those of you who don't know me, I'm Dr. Maribel Radialis. I am in the Atlanta metro area. So I always like to let you guys know how to find me. So it is phone number 770-266-0933. And the address is 924 West Spring Street. So 924 West Spring Street, Monroe, Georgia. All right, so let's talk a little bit about some of the challenges that us girls have with our monthly adventure. First of all, let's talk about what to expect and what is considered normal. It is normal for having a cycle between 27, 26 days all the way to about 30, 31 days. That is considered a normal regular cycle. And there's going to be variations from month to month, especially in the follicular phase. That means the first part of your cycle in compared to the second part of the cycle, or the luteal phase, which is from ovulation to the next menstrual cycle. The first 3 years after you have your first period, it is normal to have irregular menses because your body is still maturing. Full sexual maturation is not reached until about 17 to 18 years of age. And they've done studies about teen pregnancy and all of the risk factors associated with sexual immaturity. For example, twin pregnancy and early onset of osteoporosis in adulthood, twin pregnancy and increased rate of C-section because the hips are not big enough to accommodate a fetus, twin pregnancy and preterm labor, prematurity, small for gestational age fetuses, again, all related to an immature sexual organs. So we don't reach sexual maturity until we're about 17, 18 years of age. And the first 3 years after your first period, it is normal to be irregular because of what we call the hypothalamic pituitary adrenal ovarian axis is not fully developed. Okay. That's why personally, as an OBGYN, I do not encourage parents to put children on birth control pills that early in their development, because that will have later repercussions. And I see it all the time. I just had a conversation today in my clinic with a 31-year-old that was placed on birth control pills at 16, and right now at 31 she wants to have a baby, and she stopped her birth control just to realize that she has suppressed her ovarian function for so long and since such an early age that her ovaries are almost menopausal. She is not being able to ovulate, and she's having a lot of problems getting pregnant. Okay. So going back to what to expect and what's normal, and I know a lot of parents, you don't remember as a woman exactly how it went. That's why I'm kind of going through that for those of you that either are going through this with your teenagers or eventually will start going through it with their teenagers. So let's go back just a tiny bit. Sexual development. So in females, sexual development actually starts with the breast buds. What is that? As a 9-10-year-old, you start having a little bump underneath one of the nipples. It's usually one side first and then the other, and then breast development starts. Usually it will hurt. And so your daughter might be complaining of that little ball that hurts in her chest. That is actually normal. After that, there is hair development in the sexual areas, armpits and vulval area, followed by the growth spur, and then menses start. Okay, so that's what's expected. And then, like I was saying, the first 3 years, you can expect girls to have irregular menses and or start having cramps or no cramps. Ovulatory cycles are associated with more cramps than non-ovulatory cycles, and in that starting stage of those 3 years or so, you could have anovulatory cycles that are painless, and then sometimes your daughter might complain of pain and sometimes not. Okay, so as we move along through our girly path, our journey as women, then you have the reproductive age, right? And then you go through those things. And through those years, most of us will be regular, but some will be irregular, all right? And the reasons for that, and a few weeks ago, I talked about PCOS, and that's one of the reasons that you could be irregular since you don't ovulate every month, okay? And there are other reasons to be irregular that is not necessarily PCOS, all right? But that's one issue. And then you could have heavy menses, even as an early teenager, and that needs to be checked because you could have a coagulation disorder. The most common is von Willebrand's, which is a deficiency in factor 8 that will present early on as the girl starts bleeding and the bleeding is excessive. A normal menstrual cycle is about 80 milliliters, okay? So that is really not that much. So if you're having anemia because of your menses, we need to check. That is not normal. You could be having either a disorder in your hemoglobin molecule, like sickle cell or hemophilias or thalassemias, or you could be handling a coagulation disorder like the von Willebrand's. Okay. And then what happens with pregnancy and postpartum as our bodies change, okay? And as we age, what happens in terms of, other factors that could be complicating matters. One thing that will complicate our periods is pain. Some degree of pain is considered normal because of the prostaglandins that get created in the process of inflammation and shedding of the lining. Okay, so there's some cramping involved, but too much of a good thing is a bad thing, especially cramping. So then, are we handling endometriosis? So, is there something else that we need to check on? A close cousin of endometriosis is adenomyosis. It is usually not found in young women and women without children, but as we start having kids and our uterus goes through that process of having a placenta attach and detach, sometimes the glands of the uterus penetrate the muscle, causing adenomyosis. So what's the difference between endometriosis and adenomyosis? So endometriosis is cells from the inside of the uterus that grow outside, creating little spots of period, okay? So you're bleeding in the wrong place, and that's very painful. And then adenomyosis are glands of the inside of the uterus that are implanted into the muscle and also cause pain. Adenomyosis usually cause heavier bleeding with it. Okay, usually endometriosis is not associated with increased bleeding, but it's associated with cyclic pain in the less severe cases. Sometimes you can have severe pain and constant pain that is worsened during periods. That is very important. It's usually worsened during periods, and that could be an indicator that you have endometriosis. So we talked about irregular periods and ovulation disorders, pain syndromes in endometriosis, pain syndrome with menses. And then let's talk a little bit about postpartum multiparous and heavy bleeding. I kind of mentioned, the adenomyosis as one of those heavy bleeding. It's kind of crossover between the pain and the heavy bleeding, but it's in there. Another very common factor of having heavy menses are uterine fibroids that usually will present later on in life. I normally see it after 30, after 35, when they start showing up. And what are fibroids? They are benign tumors of the uterus. So it's a cell of the muscle of the uterus that starts growing on itself and creating a little mass. It looks like a ball, looks like a ping pong ball, okay? And they tend to grow very, very, very slowly, but eventually will disrupt the natural architecture of the uterus, causing a disruption of the menstrual cycle with heavy bleeding and potentially pain, and a lot of discomfort as those masses grow and the uterus grows. So those are the most common reason for heavy bleeding, together with coagulation disorders and hemoglobin type disorders. Okay. However, I know that as we go through life, our bodies do change, and then especially after babies, we tend to have heavier periods. And what is that? There are several factors for that. One, in a uterus that has expanded to accommodate a fetus will seldom return to its normal size. So it's a matter of just having a slightly larger uterus being multiparous, when that means that you've had more than one child. And the more children you have, that stretching and going back will create heavier menses, just for the fact that your uterus is larger. There's two more things that come to mind right away. One is nutritional deficiency, especially vitamin C deficiency. Why? Because some of you have heard me before, a pregnancy is an accepted parasite. So what does that mean? Through the pregnancy, that fetus, that baby is going to be depleting you from your natural nutrients, minerals, vitamins. And if you are not feeding yourself appropriately or supporting with supplements, you will have deficiencies postpartum that can present as heavier periods, okay? Vitamin C being one of them, and that's why pregnant women and postpartum women will have more problems with their gums, more bleeding with the gums, because of the vitamin C. And why is vitamin C so important for the pregnancy? Because vitamin C is crucial for skin and bone development, right? So you have a baby that's growing, it's gonna suck up all your stuff, all right? So it could be corrected maybe just with diet, some of it at least. The second thing that happens as we age is our hormones do change, and our biological reserve it starts to get diminished. So then there's something called progesterone sequestration syndrome. What does that mean? Now you're a mom, you're dealing with life, you're not 20 anymore, and then suddenly your adrenal gland that handles stress, and by the way, is the #1 reservoir for vitamin C, and it needs vitamin C like crazy, even more than your immune system, is being affected. Okay, so therefore the precursors for progesterone, which balances the second half of your cycle, is diverted to support the adrenal and its needs, because the adrenal is considered a necessary organ while the ovaries are a luxury organ. Okay, that's very important. So as you are progressing through life, now maybe you're in your 30s and 40s, you notice that your cycle is shorter and you're bleeding more. And when you actually dig into your hormones, you're not making as much progesterone as maybe you were making before you had your kids. And then what happens is the estrogen at the beginning of the cycle makes your lining get thicker and thicker and thicker. That's what it's designed to do. And then after ovulation, progesterone stabilizes your lining and inhibits the growth, and it makes it chunky, okay? It makes it full of nutrients to support a possible pregnancy. But if there's that imbalance, then the estrogen is going to continue growing that lining. There's not enough progesterone to stabilize, and then you end up having a heavier cycle. So that's something that is usually not discussed, and I think that personally I experienced that after my third child. I noticed my period was really heavy, and I didn't quite figure out what the problem was. And it took me doing some additional outside the box reading to figure out what was wrong with my cycles and be able to correct it. And I was actually able to correct it with something very simple. And that was Glandular Therapy, which I used like crazy, and chaste tree, which is a wonderful little herb that helps regulate ovulation and supports the luteal phase and the progesterone production in the second half of your cycle. Okay. Alrighty, so let's see. I know that I did receive a few questions on a personal blog, and I know that one of the questions was on that postpartum thing, and why do we bleed most postpartum? And like I was saying, part of it is just because we have a larger uterus, so there's more lining to shed. And two, a lot of postpartum ladies, especially if they have babies back to back, will have some degree of progesterone sequestration. And that is not something that gets discussed. I mean, even me as an OBGYN, I was completely unaware of this concept. And it was through my studies and when I was finishing my naturopathic degree that I was able to figure that one out. Okay. Together with that, so yes, so somebody had asked me about PMS and what that means. PMS is very, very closely related to that deficiency. And the deficiency is usually really, really small, but that deficiency in the progesterone, where you have unopposed estrogen causing all of the mood swings and engorgement and all of the symptoms related to PMS. And again, chaste tree is like amazing. Being a mother of 5, I have chaste tree in my house in liquid form, in pill form. I'll put it in their coffees, in their milks, because it will really calm them down. Okay, I can definitely tell when the girls are about to have their periods, because teenage girls and periods, it's interesting. And it definitely calms them down. It calms me down, and that's like super, super cool. Okay, so Ashley is talking about, the COVID vaccine and all of the buzz in the news about it. There's not enough data on the COVID vaccines because of the urgency. All vaccines were released earlier than when normally they should have gotten released. Usually vaccine research takes 2 to 3 years, while this was like, vaccine research on speed. So, I don't think this is, there's not enough data to say one thing or the other. There's some preliminary data saying that it does not increase miscarriage. I know that that came through a colleague recently, but it's a very personal decision whether to do that or not. And there's a lot of things to consider personally and collectively. Okay. So going back to how our bodies work and our system work. So what happens as we move along? So now, I've talked about reproductive years and quickly after reproductive years. And usually, puberty, everybody makes fun of, teenage hormones and craziness. Well, our way out is not necessarily a lot better. I love working with women in all the stages, but I know that I do have a lot of women going through perimenopause and menopause and all of the changes that happen in that stage that will also, of course, mess up your cycle. So as we head into kind of that perimenopausal, menopausal stage, you could have heavy bleeding again, and it just has to do with now you're having anovulatory cycles and unopposed estrogen, the estrogen progesterone balance is not there anymore, or you can start having scant cycles, meaning they get shorter and shorter and lighter and more spaced apart. By definition, menopause is 1 whole year without having a period. That means that you have crossed over. However, the perimenopausal stage could be up to 10 years prior to that 1 year of no more periods. And as we move along, all of the menopausal ladies, they know they start having that increased belly fat, and it's harder to lose weight, and they get really frustrated. And it has to do with all of the changes. The adrenal glands take over some of the hormone production. The ovaries start making less estrogens and progesterones and testosterones. So it's interesting on our way out, just as we have going in puberty. So somebody's asking about what's the different vitamins and supplements you can take to help, menstrual vaginal health. So in general, I think that everybody should have a whole food multi-supplement, multivitamin, and that's just general support. I personally like a lot of glandular therapy, and the beauty of it is that it can be used, it's food-based, it can be used at all age groups. So I mostly see fertility-related patients, but I also will give the same supplements to the perimenopausal that are going through this mood swings and hot flashes and vaginal dryness, and to the teenagers that are having the mood swings and the insanity that goes with that stage in their lives. What do I mean with glandular therapy? In Chinese medicine, like heals like. So there's several supplement companies. The one that I use the most is called Standard Process. There's another one that I absolutely adore called Ancestral Supplements, where you are eating ovary, you're eating pituitary, you're having adrenal, you're having liver, you're having a kidney and spleen. And that supports that organ in more than one way. One, it's having almost like a whole perfect other organ to give you exactly what this one needs. It's almost like having a car and having another car for spare parts that is exactly the same model. Okay, so it will have the minerals and the vitamins in the ratios that organ needs it. Two, it also has the nucleus and the DNA, and it works by almost like by desensitizing the immune system in favor of the organ. And there's some preliminary studies that say that it helps it kind of work better by just providing a blueprint. Okay, and since we are, most glandular therapy is either cow or pig, then we are mammals. So the similarity in the DNA is so close that it serves as a jump start for that organ to work a little better. Okay, that's one of the hypotheses or theories behind that. In terms of herbs, like my ultimate, like the number one herb for girls is chaste tree. It has multiple names: chaste tree, vitex, chasteberry. Okay, it's a little tree, and it's the berry from that tree, and it is just absolutely amazing. And you feeling cranky and PMSy, just take one of those two pills, one or two of those, and within 20 minutes you feel yourself calm down. There's a few other ones that I really like. I like licorice root and ashwagandha. And why do I like that? They support the female system indirectly because they support the adrenal gland. The adrenal gland I feel that it's the forgotten gland. It's our stress gland. So if anything else is, super stressful in our lives, both physically, chemically, biologically, whatever it is, and that gland is fatigued, it's going to mess up our thyroid, is going to mess up our ovaries, and the adrenal is the one that handles circadian rhythm. That means our sleep patterns, okay, by decreasing and increasing cortisol depending the time of the day. So licorice root will bring down cortisol, which is our stress hormone. By doing that, then we're supporting the ovaries and we're supporting our overall feeling. Ashwagandha also decreases cortisol, and increases the functionality of the ovaries and testosterone to physiologic levels, okay? I personally enjoy taking ashwagandha at night because it really is a very, very calming herb. You take it with the licorice. The licorice will not get you a sleepy feeling, but the ashwagandha, it knocks me out. It really calms you down, and it really, really helps. All right. So one more herb, primrose oil. I like primrose oil. Primrose oil is used in several areas. I personally use primrose oil trying to get my first kid out because it will have prostaglandins. If you put it up the vagina, it will soften the cervix. And it also helps with PMS by having some of the hormone precursors to help. But I prefer the herbs that I had mentioned because you're going to have a more dramatic effect on them. Okay. All right. Well, thank you so much for joining us. I hope that this will help you now or in the future. You just never know. And I shall see you in 2 weeks. Bye-bye.